bit cold today. I haven't done an update for a while, but a few things have been happening. Just to recap, I had a telephone call with the oncologist who said, well, you know, it's going up. You need to go for a scan. PSA is going up. It's doubling every 3 months. Still low, but doubling every 3 months. So I went off to a scan, a PT PET scan, and up in Norwich. Had the scan, and then there was confusion about where the scan actually went. Norwich said they sent it to Ipswich. They sent it somewhere else, and after about 2.5 weeks of ringing around, we finally managed to find it, and it was sent to my oncologist, who rang up and said, and I have to say, I consider it good news, that they couldn't find anything. But as he said, the PSA is going up, but they just couldn't see it. It must have been so low at that point that it wasn't detectable. So I was dancing around the room, but my wife was really not happy at all, because she said, well, if it's detectable but you can't see it, what's happening? So we've got a second opinion next week. We'll see about that. And I can understand how she's feeling, because sadly, a friend John that I've mentioned before died a few weeks ago. I've known him, and he helped me through the original chemo and looking after myself and so forth. And was a good person to talk to. Then he had lung cancer, had chemo, not the full treatment, unfortunately, because of lockdown, but he had chemo. Then he was given these tablets, and everything was wonderful. And just up before Christmas, he was going for walks, and then literally one morning, he sat down with with his wife and a friend, and he started to feel that his eyesight was going a bit, and his speech was starting to get a bit slurred. They thought he was having a stroke, so they rang the hospital and eventually spoke to the oncologist, and he said, bring him in. So they brought him in. He had another scan, and the cancer had gone to his brain, and it just like that just suddenly came out, and he was dead within a few weeks. So that's frightening. So the scan I had goes up to the eyes, to the knees. So my wife's worried that from that bit there might be something that's there, but we'll see. We'll see what the PSA blood test in April comes up with. It may or may not be good. I actually think it probably will be all right. But, you know, it's still unsettling times. My wife's really up and down all over the place. She's worried about booking holidays in case I fall ill abroad, and I can understand all that, which is quite frustrating, because for some reason this year everybody I know seems to be off on holidays, and neighbours across the way 2 months in New Zealand, our other neighbours 2 months in the south of France, my sister 2 months travelling around France in the camper van in a couple of weeks' time, my other neighbour off to New York, and then she's off walking the Pyrenees, and it's just, and I feel trapped by this cancer, the medical care. You know, it's one thing going through all of this, but when it impacts your life and you want to live every day, but you're frustrated in that you can't live it the way you want to live it. To be honest, it gets me down a bit. And I've been feeling a bit down recently, but still, you know, you have ups and downs. This new drug, incidentally, I'm on, isn't the same as my old drug. And I asked why is it different? And they said, well, the doctor chooses which one he wants to give you. So I scurried to the filing cabinet, got the letter out again. Sure enough, he's given me one of the 3 choices that they were given. But in amongst that 3 was the one I had previously. So I thought, what's different about this one and the other ones? And I Googled it, and the one I was on previously is more aggressive than this one. If I remember when I get back, I'll put the details of the drugs in the notes below. So the one I'm on now seems a lot softer than the first one, and if I were to choose again, I would choose this one. I don't get the heavy aching muscles as the other one gave me, and the insomnia, yeah, the weight, the fluid gain, yeah, but nowhere near as bad so far as the previous one. But it's early days and we'll see, but so far it's not been so bad, and I am going to continue volunteering on Alford Ness. I did ask about bicycles, because I said about, would that be an issue? Because I was told quite categorically I shouldn't cycle, and I still haven't really got a proper answer on that. Maybe I'll get one next week. But anyway, that's a long one this time, 6 minutes. So hope you're all well. Bye for now.